and we will be sharing what neighborhood health and wellness hubs are all about. So we'll just overview a general overview of what neighborhood health and wellness hubs are, who they help support, and we'll save some time at the end for some questions and answers and any discussion that comes out. So we'll be sharing what is a neighborhood health and wellness hub, why were they created, what are the missions and goals and objectives, who to refer to, and how to access the hubs, the locations and services, and how to share further. The history of the hubs were created during COVID. So in 2021, hubs were originally created to help with COVID immunization needs in priority neighborhoods. So the access to early pandemic vaccines had so many barriers. There was rollouts for age restrictions, priority groups, there were supply shortages, and hubs were created to address these disparities in health equity highlighted by the pandemic. And some extra barriers included people working different hours, shift work, difficulties with accessing transportation, and more. There was a needs assessment with data-driven input, and hubs were strategically located in priority neighborhoods that had high socioeconomic disadvantage. So these neighborhoods were also seen to have high infection rates of COVID as well. And the aim was to try and improve the disparity between neighborhoods that did not have deprivation and reduce the vaccination rates between the different quintiles. So a quintile, just a quick overview, is a statistical measure. There are 100 different sections of neighborhoods all over Ottawa, and if you split them up into 5 equal groups with measurements of deprivarities like social economic status, the quintile 1 is the least deprived, and quintile 5 is the most deprived. So our focus is really on the 5th quintile neighborhoods with the least advantage. Since the pandemic ended, services and operations have improved to focus on prevention, and we continue to engage with partners and clients and staff to continuously improve our services. So, neighborhood approach with place-based supports. The purpose of neighborhood health and wellness hubs is to contribute to health equity and optimal health outcomes for everyone in Ottawa. This approach is to target priority neighborhoods and support underserved communities with resources that they need for better health outcomes. So this emphasizes equity, inclusivity, and community well-being, highlighting the role of hubs in equity to achieve these better health outcomes for everyone. The focus is to have a place-based neighborhood approach, so aiming to ease the access within neighborhoods, so providing services right in neighborhoods where people live so that it's walkable, it's easy to get to, it's in a potentially comfortable location where someone can have easier access to that location. Other barriers can be including transportation. We adjust our working hours to provide evening hours, and also supporting people without OHIP cards and those new to Canada. We do also try to target those without primary care providers. However, those are referrals and service-based approaches for other services that are available. We don't actually do any primary care health in the hubs. So what are neighborhood health and wellness hubs? Last year alone, we had supported over 16,500 interactions with people in 2024. So this is a pretty big number, but our focus is really to provide quality interactions with residents to support and do some system integration to be able to get the service and information that they need. So these are health and social services that they are free. They are drop-in, there's no appointment needed, and we're building trust in communities that are equity deserving and often underserved. And having a person in person to talk about for health and social support to access services. Um, there is also the benefit of increasing our presence of Ottawa public health staff in neighborhoods that may not be familiar with us, and increasing the visibility. So the picture on this slide is 1475 Caldwell, and this is a hub in the Carlington neighborhood. And Carlington is also a Quintile 5 neighborhood, as we discussed before. Why a neighborhood hub? These priorities align with OPH's, Ottawa Public Health strategic direction for equity prevention and impact. So providing convenient, comfortable, community-based locations aligns with this. Equity in terms of service delivery, prioritizing equity by locating services in high priority neighborhoods where the measures of health status indicate greater needs. These are addressing barriers, access, building community trust, and community engagement through relationship building. We also provide multilingual staff and resources when available to help reduce language barriers as well. Prevention, we focus on upstream interventions to improve health outcomes like vaccination, cancer screenings, and wellness programs, which we will discuss further and what services are available. And impact, we align data-driven priorities to deliver high-value services. So bringing services together in one place isn't just efficient for our service and our OPH teams, but also for clients accessing these services. Being able to drop in to one location and get multiple services in one trip is really efficient and convenient for them. I'm going to pass it off to my colleague Halima to talk about the services provided.
So thank you so much, Jenny. In terms of the services provided, and we have an OBH services. So vaccination is one of them. Immunization is our largest service at all the locations. So providing assessment and vaccination services for COVID vaccine, routine, and school-based vaccination for children and youth, as well as seasonal vaccines such as the flu. Hubs can get very busy in the fall as they have in the flu season. But as I mentioned, it's a different types of vaccines that we provide in the immunizations with our immunization team. We also have dental screening that involves a hygienist giving a free dental screening in certain locations and information also with the public and answer any question that they may need to answer, as well as referring them to the different programs that the dental services offer throughout the city. Also, another program that we offer within the OBH services is parenting in Ottawa. And so people can come and speak to a public health nurse about parenting, feeding techniques, breastfeeding, and sleep, and so on. They can answer any question for new moms or postpartums. They also offer to weigh the baby for them, and as well as also referring to the different services throughout the city. And services that we offer through our partners within the hubs are the employment social services, for example. So it's access to social assistance programs, including financial, housing, employment services, and referral systems. We also have in the Champlain Cancer Screening Outreach. It's a partnership with the Ottawa Hospital, and that you can see in a registered nurse or a nurse practitioner that can go through a screening process with the patients. And through the screening process, they book them an appointment in the system to have a cancer screening. We also have the Aging Well in Ottawa, which is an information session about aging well, as well as the programs and services to support. These programs and often are in partnership with other partners, and they're more they look like more like a workshops or information sessions, and it gives the older adults an opportunity to go through them and answer any questions that they may have. Next slide, please. So the hub locations, currently we have 10 locations that we provide services. Each location looks a little bit different than the other ones. So, and some of them are in libraries. We have one currently, it's the Emperor Plaza Library, and we have Bakerfield House, and then we have few in community health and social services and centers, and such as the ACP Wellness Center, Cudwell Family Center, and Center Town, as well as Rita High School. We also have a few of them located in community faith centers in AMA, which is one of them, the Al Sunnah Muslim Association, and St. Aidan's in Church. Some of these locations are city locations, and for example, the Foster Farm Community Center and Hand Club Riverside Community Center. Location were based evaluated on data and evidence, as well as community feedback and partnership along and with our partners. In many neighborhoods, they're not they look different in each space, and the buildings look different as well. We don't some of them will provide similar services than others, but some of them will provide 1 to 2 services. So each hub have a different feel into it. And the hub sites were originally selected based on the areas of the city that have the highest COVID-19 infections and rates. So we began to offer the vaccination in these Q5 neighborhoods and with the highest in social and material deprivation. So a quintile is a statistic measure that represents 20% of the population, and Ottawa is split up to 5 quintiles, as I think and Jenny explained earlier. So, and a lot of them are located in the 5th quintile. Thank you. So strengthening the hub evaluations and lessons learned. So in 2024, OPH evaluated the neighborhood wellness and hubs and incorporated members' feedback to identify strengths and opportunities for growth. So together, the evaluation findings and the feedback showed a few strengths to build on and opportunities for growth. An example of the strengths to build on were effectively in that we address vaccination needs, reaching undeserved individuals. Also positive and community feedback on staff and adaptability and a strong logistical and coordination and communication with partners and low barriers access. So no appointment is required at these hubs and they're convenient locations, and a strength Ottawa Public Health presence in undeserved area as well. Few opportunities for the growth that were mentioned as a result of the evaluation were increased community awareness and outreach, align the services with the demand, so in terms of the staffing, the operational hours, and expand offerings, so for example, youth programs, nutrition support, and system navigation as well. Next slide, please. So the next step for the Neighborhood Wellness and Hubs strategic plan or next steps for 2025-2027 is, and the main thing that we do with the hubs is that we're aligning the strategy of the hub with the OBH 2023-2027 strategy and building on the progress that we made in the last couple of years, which is 2023-2024. So the strategic plan includes 3 main pillars, which is the maintain, so ensure consistent services that meet the community needs. And the second pillar is sustain, optimize resources, strengthen infrastructure, and improve the operations. And the last one is enhance, which improves service quality and responsive to the evolving needs of our community. So these are the main 3 pillars that we're gonna focus on 2025 and 2027 for the hubs. Next slide. I'll pass it back to Jenny.
Sure. Thanks, Halima.
No problem.
So we are trying to increase the awareness and promotion of the hubs, letting people know that they're available and being able to support the clients that need it most. So one of the ways is we do have a website that has all of the locations and more information on services. It's the place that has the most up-to-date schedule. So this is just an example of it. We do know that not everyone has access to the web, goes on the web. It's not convenient for everyone. So we do try and share the schedule and posters on site and try and limit any last minute changes that happen. So our aim is to provide consistent service as much as possible. So in order to branch out and increase that awareness, we do have a monthly email that has all the posters attached that we do share with partners and anyone that is able to share this further and has a service or is located in the neighborhoods that can post these up in their area. And if you would like to subscribe to this monthly email, you can email me, ginny.stern@ottawa.ca, and I would be happy to add you to that email list. We really only send out one a month, and sometimes we include a few updates that are happening in the hub. So if you're interested, please let me know. In summary, we're just the neighborhood health and wellness hubs are community led and promoting health equity. So merci, Nakamik, and thank you for joining us today. We do have time. If you have any questions and you want to put anything in the chat for us or discuss further, happy to hear from you and go from there.